Facelift procedures, or as we call them, face and neck lift procedures, are commonly done operations to help reverse some of the aging that occurs in many of us through time. Time affects skin with sun exposure, with cigarette smoking, with weight changes, and certainly hormone changes. We can't affect anything that has gone before, but the procedure can certainly help reset the time clock. What do we treat? With face and neck lift, primarily the lower third of the face, the jowls, the mandibular border, and certainly the neck, along with the wattle and excess skin, can all be effectively treated. All the wrinkles of the face, the lower face, the neck, don't leave with facelifting procedures. There's some adjunctive treatments that we can discuss at the time of consultation. But for the main component changes of aging, facelift is still the gold standard. There's a variety of facelift techniques. I prefer facelift techniques that reverse these aging changes and last a long time. When I say last a long time, we reset the clock 5 to 7 years. We don't stop the aging process, but over time it still looks very good. How is this accomplished? Well, using deeper tissues, not just relying on the skin, allows for this longer lasting result. Because this technique is done at a deeper plane, I prefer general anesthesia. That can be accomplished in my accredited operating room using board-certified anesthesiologists to provide the anesthesia surfaces. What doesn't a facelift do? It does not stop the aging process. As I said, typically a reset of 5 to 7 years is what I tell patients to plan on. That sounds pretty good in 5 to 7 years, still feeling 5 to 7 years younger. But that decision's up to you. It does not approve any of the areas around the eyes or the forehead. Come in, we can discuss alternative or additional procedures that may affect these areas if desired. Skin blemishes and scars, if they're in the area that are resected, they're removed entirely. Otherwise, they are moved to a different position. Fine wrinkles typically don't go away with facelifting. Initially, they may be gone, but again, there are alternative treatments that may improve the overall character of the skin, and those fine wrinkles become less of an issue. Unfortunately, facelift procedures do require scars. Fortunately, these scars can be well hidden in the hairline, behind the tragus of the ear, that's that little spot in the ear, behind the ear, and into the posterior neck hairline. Most scars, once healed, become less evident as long as hair itself is not distorted and the ear is not distorted. Points I pay particular attention to for my patients. Face rejuvenation may also include fat injection or dermal fillers, Botox, or surgeries to other areas of the face to bring about a more youthful you, so you can feel when you look in the mirror as young as you feel on the inside. I suggest you come in, we have a consultation, and go over each and all these options to see if any are what you have in mind for a new, youthful you.